And public health officials are on alert. 3 additional cases of novel coronavirus confirmed in the U.S. over the weekend, bringing the national total to 5. The latest cases are in Los Angeles and Arizona. All of those infected here in the U.S. had recently traveled to Wuhan, China, where the virus originated, and at least 80 have died. That city is still on lockdown, with some Americans unable to leave. So what are the symptoms, and should we be worried here in the Valley? We welcome health educator Leticia Berber and health education specialist Valerie Martinez, both with the Fresno County Department of Public Health. Welcome, ladies. How are you today?
Thank you. We're doing well. Thank you.
Thank you for being here. First of all, Leticia, what is a coronavirus?
This is a very a novel coronavirus, a new virus, and that's what novel means. It's a new virus that appeared in the city of Wuhan, China. This is something new, something that we weren't expecting it. It's causing deaths in China. Now we have 5 confirmed cases in the United States, 2 in the LA area, very close to home. No cases have been confirmed in the Fresno County, so no confirmed cases in our region so far.
Okay, and then for those that are wondering, Leticia, what is the corona? What does that mean exactly?
Coronavirus, it's a name because of the shape of the virus. It has a small crown around itself. So this virus will cause common cold symptoms, and people right now, it's a new virus, so we don't know how it's transmitted. We don't know how bad it's going to be. I know right now China it's really, really bad, but here in Fresno County we haven't seen any cases. According to the CDC, right now we are saying to the public that if you travel to Wuhan, China, came back and have symptoms, please call your medical provider and let him know about let him or her know about the your history of travel, and they'll take care of you.
And talking about symptoms, Valerie, what are they?
So, like Leticia said, they're flu-like symptoms, cold-like symptoms, and that's fever, cough, a lot of mucus, headache, yeah.
So it's like a common cold, you will say, right?
Yes.
But what makes it so dangerous?
It's dangerous because at this time we don't know if it's transferred from animal to human, human to human. It's being detected. It's causing deaths. It's causing a pandemic, or almost a pandemic, but it's causing an outbreak of pneumonia, which has led to deaths of so many people. And that's the worry right now, that it caused severe pneumonia in individuals. These individuals passed away. It's a new virus. That's what's new about this situation. It's a new virus, and we don't have a vaccine. There's no cure for it.
Now, what should the people in the Valley do to protect themselves?
Yeah, right now, keep in mind that if the CDC has informed us in the state of California that if you did travel to Wuhan, China, returned, have those symptoms, please notify your healthcare provider. Keep in mind that if you haven't traveled to this area and you have been close to this area, there is no worry, no alarming issues right now. You should just keep an eye, stay healthy, get your flu shot, because this is something that's very similar to the influenza. So get your flu vaccine as soon as possible. Stay healthy. If you have those symptoms, the common cold symptoms, stay home. If you're sick, stay home. Don't send your children home if they have those symptoms. If you haven't traveled to this city in China, there's no worries at this time.
Okay, and then, I'm glad you mentioned the whole vaccine aspect of it. So right now there's none for the coronavirus, but do you think a flu shot might help with this?
Your flu vaccine will protect you against the flu. Again, these are very common symptoms of the coronavirus, same as the flu. Like Valerie said, headache, the sore throat, the cough and the sore throat. Those are very common to the flu. The vaccine will help you stay healthy and prevent those symptoms.
And then who's more prone to get it?
Yeah, according to the CDC officials, they're seeing that these deaths are in individuals that have other health issues, such as heart disease or asthma or other health issues. That's where the deaths are occurring.
Okay, and then for the people that missed it earlier, what is that definition of novel?
Novel coronavirus, it means it's a new virus that hasn't been identified nowhere in the world. It's new. It's here. It's a little, it's something that it's new for us. So we don't know, there's no vaccine, there's no medication, but there are ways to prevent this. There are ways for you to stay healthy and prevent that from getting sick.
And Valerie, what should people do if they think they caught the virus?
If they think they caught the virus, if they traveled from Wuhan, China, they should call their doctor. They shouldn't go to the clinic. They should call first. That way they don't put others at risk.
And because, okay, right now here in the Central Valley, there's no cases so far. But what if people travel to LA and they think that, okay, wait a minute, I have a couple of symptoms. Like you said, just contact your doctor then in that case, call them and just tell them. Would that be
Tell
the
them
right
your
thing?
history, your travel history, if you were at an airport or, just make sure to tell them.
Awesome. And then for those that are watching and they want to get more information on this virus, where could they go?
Right, if you want more information, go to the CDC website, and they have this website where everything's up to date, how many deaths, how many cases, what other countries are affected by this virus. Please stay informed. You can also call your local health department as well, but your main source will be the CDC website.
Perfect. Ladies, thank you so much.